Saturday marked the launching and official handing over ceremony of the Refurbished Ndemban clinic in Bakau to the government. The clinic served as a treatment center since the pandemic began earlier this year. The first phase of the refurbishment of the clinic was first initiated by the CEO of TAF Africa Global, Mr. Mustafa Njai, in April, and then a partnership was created with the UNDP, WHO, and the World Bank for the second phase, which began in August to October.
Under the TAF Africa Foundation, financed and renovated the first phase of this establishment in April, and it was completed in May. The second phase, which was in partnership with the UNDP, we commenced in August and then completed in October. We used up to 150 workers to complete this facility, and mostly Gambians. We're very proud to be part of this great initiative. The facility hopefully would have 92 beds that should help in combating this pandemic and seeing Gambia come out of it much healthier. We hope that this facility will be put in full use as soon as possible, and it will be maintained in the best way for the foreseeable future.
The WHO country representative expressed delight for the job done and also highlighted the importance of partnership in development programs.
I'm very happy, very delighted to see that we have reached a stage where we are going to open this facility, which we have been waiting for quite some time to see it completed. And this required the expertise and the resources, different resources from different stakeholders. The UN agencies with technical and financial support, the World Bank with financial support, with also the private sector also with the technical, the collaboration and inputs that made it really ready now for use. So this is a demonstration of what we actually anticipate to achieve the SDGs, where partnership is the only way. There is no one entity that can achieve anything. So this is a very good example that we can use for the future also to implement other projects or programs, development programs.
The UNDP representative was also at the event and had this to say.
As a development agent, UNDP was committed to invest, and we took resources from other programs, because everybody knows that when we started our year, we would not expect UNDP stepping in the health sector. But because of the nature of the pandemic, our role, our international institution, is to support the Gambia in setting very strong health systems that can help to address all kind of shock that can happen. And this was why we were a step in.
The Minister of Health, Honorable Samate, stated that this is just the first step and there will be more development in the healthcare sector of the country.
The Gambia is moving on, because we cannot continue to stay where we are. Of course, we cannot dream of going back to where we came from. But where we are itself is not good enough, and we need to move on. And I want to tell this gathering and the people of this country that the government is committed. We have a very committed government that is committed to enhancing the livelihood of this country, the people of this country. We have a government that wants the people of this country to live like if they were in Europe or one advanced Middle Eastern country. The structures they have there were built by people, and they use stone, they use cement, they use sand, and most of the items that we use here were imported from those countries. How come Gambia cannot be like one of those countries? With the attitudes, with the commitment, with the sacrifice, patriotism, and love for country, we can do it. And the health sector wants to be a pioneer in this crusade. The health facilities, this is going to be the standard, and the march has started. Edward Francis is going to be next, and the other facilities, they all need to improve It is doable, but the attitudes need to change. We don't have to see, in fact, we have to start seeing public property even more valuable than our own properties.
Reporting for the Fatu Network News Review, Jack CCJT.